We're in the peripheral nervous system, part 3, and we're looking at the nature of nerves and neurons and so on. And we're going to come down here now to the perception of pain. In neuroscience in medical school, we had a wonderful professor, Dr. Biedenbach, who she spent a great deal of time indicating to us the nature of pain itself. And I subsequently had a clinical professor who, the good Dr. Munn, who lives right here in Alameda, who always continues to say, "You don't have pain, you have sensation." And and so that sort of like remanages the sensibility of what is pain. So at any rate, almost invariably, pain is an indication of stasis of one kind or another. There is always pain with stasis, and it could be blood or lymph or other types of fluid stasis, and it could be stasis in a different way, in which induration or inflammation has caused pressure on something. So stasis. I would recommend that you consider that as an idea. Okay, it's merely a suggestion. So here they're talking about common types of pain: cut finger, bee sting, etc. So you can sort of track your own memory with regard to it. And then we go into some specifics here that talk about, again, what I've already mentioned is pressure from a variety of things, whether it is fluid pressure, pressure from an external object, and so on. Temperature at extremes is also indistinguishable from pain. It's a nociceptor. So getting burned, or in the other direction, it's hard to tell what's cold or hot sometimes if it's at the extreme. Then we have histamine is a progenitor of pain. In some cases, potassium. In some cases, there are all of these other molecules. Bradykinin specifically is a pain-producing kinin, cytokine. That is to say, it's a molecule of the interstitial tissues. So we call them cytokines. You might have heard in recent times about the cytokine storm from certain anaphylactic COVID-19 responses that happen on some people. Okay, so kinin is a interstitial molecule of interest here. Of course, histamine is one of those molecules. When you cut your finger, it says here, you may have noticed that you first felt a sharp pain, followed by sometime later a different type of pain. And so there's different activities at work. They talk here about delta fibers providing a burning pain, carried very slowly. It's a non-myelinated C fiber. At any rate, there's also glutamate, and then there's substance P, which is similar in nature to bradykinin. It is a molecule which initiates pain. Okay, and then there are pathways that specifically travel to the thalamus. Remember that we have different pathways for touch and proprioception than we do for pain and temperature. So the neurons that get activated in pain and temperature are going to be following the pathways we tracked in the spinal cord. Do you remember that? And we were following the circuits up to the thalamus and then to the brain. Then we have, the angels of mitigation, shall we say, analgesias. Endorphins are usually more central nervous system molecules, and they are, in some cases, more powerful than morphine or heroin. There are some individual molecules that are literally hundreds of times more powerful and can eliminate pain profoundly. Then there's more peripheral types of molecules like enkephalins, which function more at joints and muscle areas, more peripherally, and they're a little bit more on the level of aspirin or ibuprofen levels of analgesia. Okay, so there's that type of thing. Then they talk here about pain tolerance, And here I'm actually quoting the good Dr. Munn. It's not pain that you feel, it's just sensation. So she often says that when she pops the needles in. A lovely MD, PhD clinician. Anyways, moving right along. They talk here about some other types of interesting pain phenomena, like phantom pain. There are people who have had an amputation and they've lost their foot, a very common finding in people with diabetes, and yet they continue to feel their foot because the nerve itself is still there, the location in the head is still there, even when the foot is missing. And so sometimes I've had patients or cared for patients who complained of an itchy foot when they had no feet. And it's just simply that the neuron was present for what had been originally identified as a foot. So when you discover your hand, you're creating circuitry to say hand. Okay, that's where hand is. Okay, and it's going to be there whether or not you have a hand from that time forward. Okay, and so the same is the case for many other organs. Look how large the kidney is felt throughout the body. It turns out this is being depicted as a female, and females don't actually feel their heart here. This is a male outflow, much more than it is a female outflow. Females have a more central referral of pain, and so when people have angina or heart attacks, the males will tend to feel it in this region, whereas females will have a slightly more centrally located situation. Look at this, the diaphragm. Do you see where the diaphragm is? I remember as a late teenager, a 19-year-old person walking past a track one day on my way home from something, and I just decided to throw down my little backpack and do a sprint around the quarter-mile track. And I had just gotten home from college at that time when I was a philosophy student and a math major, and oh my God, I was really out of shape. And I ran around the track really fast and practically fell on my face, and I was burning right here. My throat and neck were just burning. And I didn't realize it at the time, but basically I was experiencing diaphragm pain because my diaphragm was way out of shape. Not a smart move on my part at that particular time. So a little more gradual procedures is the way to go. It's interesting that gallbladders can be felt in these locations. Of course, the appendix in the McBurney's point through here is of interest to us. So you can check out referred pain in this regard, and that's what's being discussed here. Okay, so they do talk a lot about this in males particularly. It's T2. T2 comes out the second rib, and it also supplies the skin of the axilla and then the skin right there. So that's an important little detail. Let's come over to this page. Here we have the cross-section of a large nerve. Here we have a large nerve. Notice that it has lots of individual neurons, or the axon dendrites, or we call them white fiber processes of the neuron. Okay, and like muscles, large nerves have a connective tissue surrounding it. Oftentimes it's traveling with an artery and a vein. So I think of this as a vein artery nerve, or they call it officially the neurovascular bundle. And so there's often many things in here once you open up the epineurium, which is the outer connective tissue layer, which is listed right here, epineurium. You'll discover, there's lots of stuff in there. Sometimes the nerve itself separates out into these fascicles that you can see here. This is a fascicle, just like similar to the terminology we use in muscles. And the connective tissue surrounding a fascicle is a perineurium. Don't confuse that with perimysium, which goes around the fascicle of a muscle. So perineurium in this case. And again, we have a connective tissue that surrounds the individual neuron, and it's referred to as an endoneuron. Endoneurium. Okay, so epineurium, perineurium, and endoneurium. Okay, just the way you like it. So neurovascular bundle, or in my own little terminology, a vein, artery, and nerve.